Well, thank you very much for having me. We're very honored to be here this week to continue our partnership with the Ministry of Health that's been ongoing for the last 57 years and to sign two Memorandum of Understanding. These Memorandum of Understanding and partnerships between governments and private organizations are essential to sustainable economic growth. They also bring diverse perspectives and strong sector expertise that align with and help realize local government visions and goals. And I think these public-private partnerships, the governments and businesses together can create a more equitable health ecosystem, while at the same time strengthening the country's economic landscape. So there are two specific memorandums of understanding that we signed with the government. The first one is on antimicrobial resistance, which is a public health concern for the treatment and care of patients. So our partnership will focus on the major pillars of the National Strategic Plan for the Prevention and Control of AMR, antimicrobial resistance, as follows. First, and very important, we will strengthen laboratory capacity for the implementation of a national and integrated AMR surveillance system. Second, we aim to improve awareness of AMR at the public level and healthcare professionals as part of a national communication strategy. Yesterday, the Minister of Health referred to drug-resistant tuberculosis as one of the areas where a lot of more awareness and action is needed, and we look forward to participating on that. The third is strengthening the skills of the healthcare professionals on antimicrobial resistance through training, and lastly, to develop operational research on AMR. So we see universal healthcare come up in a number of countries in the region, and as we all know, it's a national asset and a priority here for the government of Morocco. We are committed to working very closely with the Ministry of Health to help achieve universal health coverage with a patient-centric approach, as the Minister put it. We will focus on improving the patient's care pathway, strengthening of health systems, and improving access to innovative medicines. So the objectives of this agreement revolve around three major areas. The first is the contribution to the improvement of the patient care pathway within the framework of universal social coverage. The second is the contribution to the strengthening of health systems, jointly identified with MSPS as part of the planned reforms. And the third is contribution to improving access to innovative medicines. And access is more than just price. Access means the regulatory pathway. Access means the patient pathway. Access means the collaboration with the government to make sure that every patient, regardless of where they live, have access to the same innovative medicines. One brief other comment and related to access. Pfizer implements differentiated access strategies and offers alternative solutions like the affordability programs to make sure that we address the financial hurdle also at the patient level. In Morocco, we have 4 different affordability and support programs to make sure we help patients that are suffering from various diseases in oncology, rare diseases, as well as inflammation and immunology conditions. With these programs, we have managed to not just reach but support more than 1,700 patients in Morocco. We're also working closely with the industry through the LEM, which is the local trade association, in collaboration with health authorities to support the regulatory framework reform to make sure we enable the implementation of solutions and new payer partnerships. So, at Pfizer, globally, all our work is fundamentally underlined by our mission to deliver breakthroughs that change patients' lives. That dictates all our work globally, including in Morocco, where for the past 57 years we have been working with healthcare professionals, with communities, as well as government to that end. Our organization, with over 219 employees, we've brought forward a comprehensive portfolio, which is aligned with global, that includes several therapeutic areas, including oncology, inflammation and immunology, rare diseases, anti-infectives, hospital products, internal medicine products, among others. It's a very specialized, very innovative and science-driven portfolio. As for our future growth plans, we envision a future where disease doesn't win, but science does. And so patients come first, and we are here to ensure equitable access where every patient, regardless of where they live, will have access to life-saving medicines, treatments and vaccines. Last year we managed to support the lives of over 3.1 million patients in Morocco, and we hope to reach out to more patients this year because we also anticipate having 10 product launches over the next 5 years, and we will continue serving as a trusted partner to governments, patients and other stakeholders in Morocco to deliver world-class healthcare. Yes, I was very fortunate to visit Al Jadida today, and Pfizer Morocco actually became a key investor in 1985 through the production site in Al Jadida, representing an investment of more than $28 million. 70% of the volume of marketed medicines in Morocco is manufactured locally. That's more than 3.5 million units per year, with 10% being exported to Tunisia, West Africa and Mauritius. In the past 4 years, the amount of investments in equipment and infrastructure at the site accelerated to an average of $2 million per year. In addition, our Al Jadida Pfizer production site is managed by a multidisciplinary team of 120 employees with a lot of focus on production and control of medicines according to international quality standards, as well as Moroccan guidelines in this area. And to ensure maintaining quality distribution of medicines and vaccines, we began a project to extend the cold zone of this plant. Morocco is an important collaboration partner for Pfizer, and we will continue to invest in its global supply network, relying on open trade to distribute medicines and vaccines at speed and at scale. Pfizer has shifted its core focus from being a pure commercial powerhouse to a first-in-class scientific powerhouse. So as we develop these innovative treatments, particularly therapies and vaccines, we also strive to impact societies positively. The Moroccan market is pivotal to Pfizer. With a population of 37 million citizens, we are proud to support here the local efforts to provide the most exemplary healthcare system, help medical facilities reduce expenses, and serve the most vulnerable patients. That is why for the last years we have continued our partnership with the government and focused on enhancing patient journey and increasing access to innovation. Our plans in Morocco as Pfizer are in line with the company's global priorities and Morocco's vision. That is why we yesterday signed these two important MOUs: the fight against antimicrobial resistance, as well as the support the key strategic pillars of universal healthcare coverage.